Hello and welcome to another edition of Another Book Review. This week I'll be reviewing Future Care by Jag Singh. I'll talk very briefly about the author, go into an overview of what the book is about, talk about what I liked about it, what I didn't like about it, who I'd recommend the book to, and finish off with what I will be reading for next time. Jag Singh is a cardiologist in Boston. He's also worked in India as well as the UK. To the best of my knowledge, this is the first book of his that he has written. He practices largely, like I mentioned, in the Boston area. And what this book is about, Future Care, is about his look at the current state of healthcare in the United States and where he thinks it's going in the next, I would say, 5 to 10 years. He acknowledges the changes that have been brought on by COVID, mostly in the areas of telehealth. He also talks very much about the possibilities of machine learning and artificial intelligence and how those things could change healthcare. So it's really about how he sees the coming digital future really impacting healthcare, what it means for patients, what it means for physicians, and really what it means for the overall cost of the system. So he does use examples of his own practice throughout the book, which I liked a lot, and grounds the book and gives you some sense of what he's talking about, things he's seen in his own practice and ways in which he thinks that technology could have improved the experience, either in the diagnostic side or on the recovery side for the patient. He also has, towards the end of the book, an example of a case where he brings everything together and basically says, here's my vision for the future of what this could look like. I thought that was really powerful. And there's a part where he talks about the AI examples where he goes through and says, we may be able to use artificial intelligence and machine learning when it comes to pharmaceutical discovery, as well as cleaning up the electronic medical records, which is not something I thought about, but he says most of the electronic medical records are written, essentially they're doctor's notes that have not really been thoroughly cleaned, and it makes it very difficult to transfer those doctor's notes from hospital system to hospital system. So overall, those are the things that I liked. The book is broken down pretty evenly between sensors, which is actually probably the longest chapter, where he talks about the possibility of using things such as the Apple iWatch and wearable sensors that people would have on inside of their clothing or attached to some part of their body, and how that information can be kind of filtered through into a kind of continuous information stream similar to an Internet of Things tied to the medical records. And so the idea would be there would be essentially a baseline case for you, and he kind of talks a little bit about digital twins throughout the book, but there would be like a baseline case of whatever your readings would be when you came in to see the doctor. And from that point forward, if there are parts of your body that sensors picked up as far as red flags that went through after the sensors picked up some warning sign, this would be sent to the doctor, and the process would be begin to try to get recognition of conditions as early as possible to really move from a state where you're always working on the problem itself and not really working earlier to prevent the problem from occurring in the first place. So really moving from a post-symptom model to a pre-symptom model. He talks about sensors in that. He talks, like I said before, about telehealth. He talks about his own experiences with COVID-19, which I thought were pretty illuminating and kind of put him on this journey towards thinking more in line with what the future of the system is going to look like. It's part about the part about telehealth, the part about artificial intelligence. So those are the things. He kind of has a chapter towards the end about cost. That was one of the things I think that for me was a con of the book. The book is very repetitive in places, and you feel that he's kind of repeating the information over and over again. He doesn't focus as much on cost as I would have liked. I would have liked him to have picked up that aspect of it and explained a little bit about how these things are going to lower the cost for patients, and he doesn't really say that. He always kind of says, well, it could lower the cost, maybe, sort of. He doesn't really kind of come down clearly on one side or the other if he wants this to focus to be on better outcomes or lower costs. He seems to imply that it could do both of those things, but he doesn't really walk through how necessarily it would do both of those things. There are times where if you're not really well versed in anatomy and physiology, he gets into relative detail as far as different biology of certain patients that have come through, that he's treated, as it relates to some of these things that I didn't think was necessarily, to me, could have been more generalized in some instances, and it did take up some page space. The book isn't super long. It's about 270 pages, but a lot of it felt repetitive, and I felt he probably could have cut 20 or 30 pages, because you do just find him repeating the same things over and over again. He talks a little bit about the digital divide. He says that the digital divide isn't an issue. He talks a little bit about maybe the need for a nationwide internet. He doesn't really get into the politics of how you would pay for that, and really the 5G versus 6G and those things. Just kind of throws out that maybe a nationwide internet would be a benefit to the healthcare system, without really getting into the fact that most people. He also acknowledges most people have cell phones at this point. There's really not demographically as big of a divide as one would think. And then he calls for kind of the global health and how these systems can interact across the globe in terms of telehealth. But that section felt a little thin to me about why someone would maybe want to do that, or how that would be covered. And he kind of goes into the COVID-19 of it all and explains the COVID-19. They loosen some of the restrictions as far as states, physicians working cross-state with one another in order to alleviate some of the backfill that had occurred due to COVID-19, and how some of that was going away, and there was more of a crackdown on insurers. And he kind of talks a little bit about how that is kind of one of the frontiers that has to be fought on. Overall, I really enjoyed the book, and I think if you're someone who wants to know where the future of healthcare is going, I thought this was really interesting. I hadn't thought as much about sensors being kind of a tool to have more of a continuous diagnostic system. I hadn't really thought much about that before, but it does sound, according to him, to be kind of the way of the future. I think he's much less bullish on things like machine learning and artificial intelligence. He goes into an example of, I believe it was Watson Healthcare in Boston, and how there was an experiment with them that turned out to be less successful than I think people previously thought. He talks a little bit about using, though, machine learning to, as far as determining skin cancers and things of that nature, where they have had some success. And he also talks a little bit about the pharmaceutical industry and how that can be used in the drug discovery process. But again, he doesn't really get into, well, will that help the consumer? Will that lower the overall cost of the system? And I wish there had been maybe more of that focus in the book, of having people with stories who have had interacted with the healthcare system and not been happy as far as the cost, to have come into this discussion here. And I think that kind of is left in the cold a little bit. But if you're someone who's interested in any of those things, he's very thorough as far as telehealth and the sensors chapter. And if you're interested in what that would look like in the future, I think he does cover those things. It's just he does acknowledge that a lot of these things are up in the air, and the benefit for them is really going to be dependent on whether or not that there are models that can replace the current model, the current fee-for-service model, which is the most common one that we have. And if there's a way for us to move to a model where preventative care is going to be kind of the cause of the day, and if there is, what that's going to look like as far as downstream, how will that change hospitals, how will that change nursing, how will that change the practice of physicians. And we're kind of at the beginning of all those things, and this is really his crack of what that would look like in the future. So if any of those things sound interesting to you, it's not too long of a read, and even though he is repetitive in places, I think you can power through it. But that is Future Care by Jag Singh. Next time, I'm still working on a couple books. One of them is Plunder, and the other one, another book with a skull cover, is XX by Ryan Hughes, which is a science fiction novel I'm still working through. So until next time, please, if you haven't already, like the video, subscribe to the channel. I'll go ahead and leave my Twitter link below. Also, we'll leave a link to a video I did in the past. I believe it is the Checklist Manifesto, and I'll also leave a link to the video I did on the pharmaceutical industry, a book called, I think, The Big Sick. I'll leave those below if you want to check those out. Until next time, bye.